I'm not anti-medication. I'm just pro-informed consent. So my last video got some comments, some that seemed rather upset. I think there was a misunderstanding on what I was saying. The post that I was in the comments on was a GLP-1 post. I don't remember what it was about. I don't. So I wasn't saying anything negative about GLP-1s. What I was talking about is that there was a comparison made between obesity and hypertension, and them both being chronic conditions, which if we're going to categorize them both as chronic conditions, then I agree. However, I think both of those things in most cases are not chronic, they're curable. I have been working with patients for over 15 years that have these chronic conditions that are of the metabolic nature. They actually are curable, not chronic. With that being said, I am a doctor of pharmacy. I am board certified in ambulatory care, which means I have extra years of residency training in helping people who have these metabolic conditions or chronic conditions. Prior to getting my doctorate in pharmacy, I have a biochemistry degree. I have several years of drug research. I'm not just coming on with an opinion that's not based on lots of research. I have read every single approval trial for the GLP-1 medications, starting back to when they were used for diabetes at much lower doses, all the way through them being used for obesity at much higher doses. We can certainly do a post about mechanism and how they work and those sorts of things, safety, etc. We can do that. But that's not the point of this post. I'm in Carline waiting for my daughter. I just want you to know that I am pro-informed consent. I am pro people making decisions based on the correct information. Maybe that is how the medication works, the potential side effects, potential long-term use. Yes, they have been around. These medications have been around for a long time. Many have. Antihypertensive medications, statin medications, they've all been around for a very long time. I don't think that that's an argument to say that they're going to be safe for everybody. But again, I am not anti-medication. I am very well versed in how all of these medications work. I have worked with a number of patients that have been on almost all my patients are on all of these medications. What I'm here for is to help people who want to know how to support their system if they have to be on these medications. I'm here to teach you how these medications work. I'm here to support you if you'd like to get off of these medications. But I am certainly not anti-medication. That's not the case. I don't try to promote a diet. I think if you look through some of my videos where I talk about ketosis, I'm not talking about a keto diet. I'm talking about getting into ketosis, which is what our body is supposed to do. That's the fat burning state. I talk about how to get there, how to utilize it, the strategies around using it to your advantage. It is how our system is supposed to work. So I'm not talking about a fad diet at all when I'm educating on that. But again, everybody needs to make their own decisions. I'm literally here just to support people. That's what I do in my everyday job. I support people and their decisions based on their goals. So I'm pro-humanity. I'm pro-informed consent. I'm pro-well-rounded decisions. I just wanted to stop and say that. But leave a comment, question if you want to know more about specific medications, because I know we haven't been talking about that lately, but that certainly is my specialty. But as always, I'm just here to support you.